promoting health promoting healthy lives and well-being for the sustainable development in Cambodia to the floor for discussion. And with this topic in mind, we are deeply interested to know what are the progresses and challenges in achieving SDG goal number 3, good health and well-being. What are the key interventions being implemented to support healthy lives and well-being of the people amidst the COVID-19 pandemic? And what are the proposed short-term interventions and long-term strategies for supporting healthy lives and well-being for post-COVID-19 recovery? So, ladies and gentlemen, honorable guests, in this meantime, we are honored to have our prominent leaders and researchers in the diverse development fields who will deliver valuable comments in our program today. So before starting our program, please allow me to introduce our honorable speakers waiting on the screen to share their presentations and comments. And unfortunately, one of our speakers, one from the Ministry of Health, is unable to make it to our webinar today due to a conflict in schedule. So we deeply apologize for that. So first, I would like to introduce our honorable speaker, Dr. Safwan Somoli Sresmai. So with more than 15 years of working in the research field, Dr. Somoli is currently working as a program manager of Research and Advocacy Program, Reproductive Health Association of Cambodia, focused on research advocacy and communities supporting on reproductive and sexual health and rights, particularly in gender lens, reflecting Cambodian social context. She leads numbers of research and assessments and monitoring at RHAC, designed as the evidences, effectiveness, and gaps between policies and implementing levels to build advocacy sector and mentoring program such as SRH availability, adolescent health-friendly services, linking between SRHR and impacts of climate change, humanitarianism, and SGBV and SRH services and interventions, as well as SRH and climate impacts. Second, please give a warm welcome to our honorable speaker, Mr. Nguyen Pro. Mr. Nguyen has joined UN FPA Cambodia as the program analyst, SRHR, sexual reproductive health and rights and midwifery since April of 2020. In 2018, Mr. Nguyen graduated with a master's degree in public health from the University of Melbourne in Australia. And in the past, between 29 and 2016, Mr. Nguyen was a midwifery program assistant of UNFPA Cambodia to enhance the midwifery education, services, regulation, and association. Before joining the UNFPA, he was a health regulator and accreditation specialist with USAID EQHA project in 2019, responsible for a health regulatory framework and healthcare accreditation system. So, Excellencies, honorable speakers, distinguished guests, ladies and gentlemen, following our program today, we will start our captivating program. First, agenda on the role of RHAC for promoting healthy lives and well-being for sustainable development in Cambodia. Second, on the role of UNFPA on promoting healthy lives and well-being for sustainable development in Cambodia. And for the last agenda, we will open the floor for a joint discussion followed by a group session with all our honorable speakers at the end of our program today. If you wish to have any questions during the presentation period, please drop your questions in Zoom or Facebook Live so that our honorable speakers will be able to address your programs once the discussion session starts. So without further delay, please allow me to invite our honorable speaker, the Research and Advocacy Manager from RHAC, Dr. Somoli, to deliver her presentation. Please, the floor is yours.
Good afternoon, everyone. Thank you very much for having us today. First of all, I would like to introduce myself again. My name is Somoli. I work for the Research and Advocacy in Reproductive Association of Cambodia. We will call it as a shortcut for that. Let me share my presentation. So, what is a non-profit organization? And we created from the International Planned Parenthood Federation, we call PPF, with over the 170 member associations across the globe. We are also one of the largest and most respected organization in health sector, and we continue to play a leading role in the area of reproductive health, sexual health and rights as a part of our health and well-being. And we also committed to be a part of one supported for our government to achieve the goal number 3 of Sustainable Development Goal as well. So I will not take a long time for my presentation. I only would like to focus it on what we are trying to commit it to do and what is our result, and maybe we can discuss it later about challenge and the way that we can go forward together. As you can see in this maps that coverage area, we work in the 17 city and province across the nationwide. And we also focus it on the vulnerable groups such as women, youth, people with disability, people living with HIV/AIDS, and the other vulnerable worker that we possibly try to find in the remote area. I would like to share with you about our strategic plan from 2018 to 2022, even though it is the last years, but somehow we can show you about what we have been done so far. Royal Government of Cambodia, we committed to promote the health and well-being of people in response to the international campaign on people and development, which is a very important part to achieve the SDG goal as well. So with the 3 commitments, the first one is about no unemployment for family planning. The second one is tables maternal mortality. And the third one is no violence against sex and gender and in all forms of discrimination against women and girls. So what we have done, we are trying to provide the quality of services, particularly on the reproductive health and sexual health for about 18 million clients who need the services. We also focus it on the people, about 2.5 million people that can do their exercise or sexual and reproductive health freely. Particularly, we focus it on youth in the community. We also committed to join the government in respecting, protecting, supporting the sexual reproductive health and rights with the gender equality aspects. So I would like to share with you the result of our work from 2018 until 2022 as a brief. Between these years, we have done a lot of work, and we have projects and programs that focus it on the particular targets audience, also in certain our coverage. With one of the program, with the funding of Global Fund, we also continue to implement HIV/AIDS prevention, and we join the commitment of 3.95 campaigns in 10 provinces in the northern parts of Cambodia. That also provide a total of about 42 HIV/AIDS care and treatment package to the high-risk group. And among this group, they are 96% receive counseling, for testing, focusing on HIV and also syphilis at the same time. We also work as a partner with over 70 health centers to improve the maternal and child health response, focusing also on the services for safe abortion, family planning, care and treatment services for the victim of the violence. I'm sorry, I don't know why my presentation stopped. Sorry about that. Let me try to. So, more than that, I also work closely with about 132 garment factory and 413 public school, and also 26 university to provide a comprehensive sexuality education, health education, reproductive health and rights throughout the group discussion, campaign, even and other lots of creative projects. And every year, around 35,000 adolescent women, men as a husband, local authority in the community also receive the knowledge related to sexual health, reproductive health, particularly on access to safe abortion and also combating stigma related to abortion. We throughout the activity of our youth activists, around 200 youth and also around 100 of our women champions who focusing on the community education. In the context of COVID-19 epidemics, we also have been actively using the visualization to reach and serve our target audience and in public as well. We work through phone call, video conference, SMS, television broadcast, and also counseling virtually. We also produce the material for e-learning and online quizzes and the other platform that possible to reach out our target group as the same as before the COVID pandemic. During this 4 years, I also achieved more than 100,000 factory workers and also 90,000 students that we are trying to provide more education related to sexual and reproductive health rights. We also support the Ministry of Education, Youth and Sport to provide a comprehensive sexuality education. So each year, about 50,000 of students receive school-based CSE, and in the average, we also provide education related to the sexual reproductive education to factory workers, 33,000 as well per year. And it is also linked to the information related to access to safe services to clinical and how to use the NSSF, which is possible for the factory workers. We also provide the support related to the capacity building to the teacher in Kampot province, which is one of our coverage. And within these 3 years, all our teachers in Kampot province in grade 7 and 10 have been provided the capacity related to how to use health education textbook, and they can prepare for the next year rollout of these new subjects. In the other part, in order to increase the efficiency of the sexual and reproductive health services, we also work as a partner with the national and subnational services provider, provide to the client with a total of 334,000 about 334,000 services in the first semester of this year. We also expected to provide the services to our clients within these 2 years with one of our projects only, we call Respond projects, with a total of over 1 million services. To achieve all of these results and to work more in order to ensure that our commitment is our strategic and achieve as we expected, we continue to commit it to collaborate with and also support it to the Ministry of Education and Sport to ensure that the CSE are provided through education program and also counseling program to all of in-school students with the aid of AVI. We also committed to collaborate with the Ministry of Health and Ministry of Women Affairs to prevent gender-based violence and also promote gender equality in the society. It's also included with the effectiveness of how to provide services and care to protect and also treatment to the victim of violence. We also committed to contribute in reducing the maternal mortality by eliminating the stigma, discrimination, especially related to abortion, and also access to youth-friendly services. We also committed to reduce accidental pregnancy and make access to family planning services. We also focused on strengthening the quality of direct and up-to-date services on sexual health and reproductive health through the services working as a partner with our clinics and the other health center, hospital, and including the hospital that consider as our partner. We also produce research documents in purposes of advocates to ensure that we are working in response to the gaps and address the challenge related to sexual health, reproductive health. Yes, at the same time, when we serve to the community, we also trying to improve the quality and efficiency of our internal operation as well. So thank you very much for your question, and if you have any question, please.
So thank you so much, Dr. Somoli, for the presentation. We are able to see the extensive coverage of RAT as an organization and the work that has been implemented. And I need to say that it is very much needed, especially in the context of the COVID-19 pandemic, and also to counter against the long-standing stigma in our society. So we appreciate that very much. So next, I would like to invite our honorable speaker, Mr. Moon Bro, Program Analyst of SRHR and Midwifery at UNFPA. Please, the floor is yours.
Thank you so much, the moderators. My pleasure to present our colleagues here and also warm welcome my colleagues from RAC. That is also our close partners, to contribute to achieve the rights for sexual and reproductive health in Cambodia. So first of all, let me share my screen. Okay, please confirm you can see my screen.
Yes, not in a white screen.
All right, okay. Okay, so, oh, sorry, my apology. All right, can you see my screen?
Yes, we can see it now.
All right, okay. My apologies for that. Okay, thank you so much. So This is thank you for the opportunity for UNAPA to present, our works on the grounds, to ensure the realization of women and girls' choice in sexual reproductive health and rights in Cambodia. So yes, so firstly, let me introduce our colleagues, the audience, UNAPA's mandates. We are focusing on 3 zeros. Number 1 is the zero preventable maternal death. And number 2, the zero unmet need for family planning. And number 3, zero gender-based violence and harmful practices. That's also, in line with our colleagues from RAC. That is a core components of the sexual and reproductive health and rights in Cambodia. And let me congratulate the government of Cambodia, especially the Ministry of Health, for the great achievements, in terms of the sexual reproductive health key indicators. And according to the CDHS, Cambodian Demographic Health Surveys 2021-2022, published by the Ministry of Planning, in terms of the family plannings, the number of, if you look at the green color, the number of the percentage of the modern contraceptive increased drastically from 39 to 45, and also the 70% for the traditional method. And also the unmet needs reduced minimally to 12%. And on the right hand side, you can see the line graph between the modern contraceptive, which increased from 90% from 20 to 45 in 2021, whereas the unmet needs, decline gradually from 33% in 2020 to 12%. So, and then in case of the trends in the early childhood mortality rates, the Ministry of Health also, have done a great job to attain our the key indicators. If you look at the blue line, the under 5, which sharply went it decreased from 124 to 16 in 2021-2022, and also the infant mortality declined to 12%, and also neonatal mortality 8%. So I think we the Ministry of Health have done a great job, to bring down this number. And also it's proud to see the trends in the delivery by our skilled bus attendants. You see it's about 100%, which is 99% in 21-22. So that is a great achievement. That's public health facility attract more clients and women to get services. And concerning the maternal care, 99% of the women receive the antenatal care from the skilled providers, which is 99%. Also, in terms of antenatal care for 4 times and plus, it's about 86%. And also postnatal care for 85%, for the first 2 days after birth. And also, if you look at the right bar chart, the green, the orange, the delivery by skilled providers is 99%. What it meant by the skilled provider is, for those healthcare provider who are trained under the Ministry of Health, approval and curriculum, and also 97% for delivered at for the childbirth at the health facility. So it is quite positive achievement, to reach the Cambodian Sustainable Development Goals. And Also, the number of maternal mortality, Cambodian also had done another great job, to reduce from 170 from 2014 to 154 in 21-22. So it's really a good achievement for the Ministry of Health. However, the Ministry of Health and the government have to work hard, to achieve some indicators, to meet the targets by 2030. For example, if you look at the MMR, which our target is 2025, which is about 100, and and then our achievement is just only about 16, from that 170 to 154. So we have to work harder to to achieve the targets. Also, the target by 2030 is 70%. So to reach the 70%, 70 is not an easy task. We have to work double hard, to put every effort to achieve this goal. And also, another important point is the percentage of the women with the modern contraceptive, which the progress is 45, while the target is 65. So I think we have to work harder to achieve these targets, because the increase just little bit, from 39% in 2014. And also the unmet need for planning, I think just only about 1% in decrease. So we have to work harder. And also, according to the Cambodian SDG, we do not have the target for this, but however, we have to work, double, hard to bring down the unmet need to ensure the women's and girls access the family planning. And also another area for improvement is the teenage pregnancy. It is our progress is 9.3%. However, we have to bring, which our target is 8%. So we have to bring a bit down to get reach the target by 4% in 2030. And also another concern is the postnatal care, decrease a little bit from 90% to 50 to 85%. So we have to focus on this area, how we modify what we have done well, what we have to improve, and also fertility. And this is the challenges I like to share with our colleagues and the audience here that come from our program monitoring, and also we have the recent MOH, sexual reproductive health annual review that participated by the 25 provinces, from the PhD, from the hospital, from the operational districts, to discuss the challenges and solution to set the new direction for 2030 and also the next direction. So let me highlight one issue is the constraint, in terms of staff turnover, healthcare providers, and also the issue with the newcomers who come to the health facility with and inadequate skills, especially the life-saving skill that we're talking about, the emergency obstetric and newborn care that we call EMOC, to save life during the delivery or after delivery. And also quality of services and the outreach activity is another area for improvement. In it's meant by the quality is it's talking about the satisfaction, also the efficiency and the safety. So we have to work, toward this quality. And also in terms of the enriched population, for example, the migrants, disability, and ethnic minorities, we have to pay attention to this area. And also saying my colleagues from RAC, we have been working together to provide the support during the pandemic. in some provinces, the bordering in with Thailand on the services for migrants workers. And also another interesting area we found is the community awareness, and local authority participation. I think we have to work on this area, to raise the awareness, what kind of services available, what women and girls can get support from the community, from the local authority. So I think this is the area that we have to pay attention to. And also public and private partnership. I think this is the area that we have to accelerate, because private sector seems play a critical role to provide the services to the women and girls. So we have to work, cement our partnership between the public and private, in terms of reporting, for example, the family planning, also the postnatal care. Maybe some it's rumor that the women might go to the private clinic or pharmacy, for the family planning. So we have to work together. And the last point is the referral system between the health facility and the community. So let me highlight about how UNFPA, implement our programs. So, we chose four modalities. One is we focus on the policy, formulation, advocacy, guideline, protocol, and to support the Ministry of Health, to design the policy, to provide services. And also knowledge management, we bring the new publication, study, assessment to inform the service, the practice, the training with the both national and subnational. And also and also in terms of capacity development, we provided technical, skills through our regional office, consultant to support both pre-service and in-service training for our midwives, especially the EMOC, the emergency obstetric and newborn care. We brought the expert, to provide the trainings for our educators, our service provider at the hospital and health center. And the last point is the essential of the sexual reproductive health services, especially during the pandemic. We ensure that the service was ongoing, and then this was done through the designing the new policy to provide services during the pandemic. How the health sector, how the health system resilient and being agile, to continue to provide services, and through the online platform and also virtual communication. And yeah, in terms of innovation and digitalization, UNFPA, as the result of the pandemic, we adapt, the e-learning platform to support the National and Maternal and Child Health Center to design the Moodle platform, which our midwives and health professionals can access, can learn, to ensure they keep up to date, their knowledge. And also we design the telemedicine to support our pilot provinces, 8 provinces, the Northeast provinces, to provide services through telephone or social media, Telegram or Messenger. And also we designed a website that service provider can access the information. And let me give you the snapshot of what we have done for the e-learning. There are 2 platforms. One is the e-learning Moodle platforms, and the other one is the Safe Delivery app, which focusing on the obstetric and newborn care that's jointly and supported by JICA project, that they are being rolled out to our health facility to ensure midwives access the training through their telephone and electric devices. And this is the progress that from our dashboard. So far, since the launching in last year, we got about over 2,500, especially midwives who access the platform. And also we have other profession like nurse, medical doctor. And in terms of the health facility, the vast majority of the facility is from the health center, which is about nearly 50%. And actually they, they somehow they do not, some might not have a chance to access the in-person training. So this is the chance for them. They can access learning through their mobile phone. And another prime example is on the telemedicine that is under the support from Japanese government. That's how we implement it. We designed the policy, a guideline on the telemedicine services, and we uploaded them into the platform, Moodle platform. And then we provide trainings through the Moodle platform. And also, in addition, also the in-person training was also carried out, at the health facility that focus on 4 services, 4 services: ANC, PNC, family planning, and abortion. And also we supported them to design the implementation plan, to roll out these services. And this is the pictures that we gathered during our visit, in Mandalore and Akiri, that how they communicate, provide services to our women in the communities. And this is really greatly beneficial to those who are living in a remote area and who cannot afford to come back, to seek health care on the postnatal care or family planning. And this is the achievement, the evidence that shared by our service providers and our customer. That we heard from the women that this was the first time that she received a call from the providers, from midwives, about her follow-up on ANC, antenatal care, which build trust between the service provider and herself. So this is fantastic. And also the achievement of this telemedicine also attributed to the management of the PhD, the provincial health department, the management of the hospital and health center, who lead this project. And this is the last example on app on the teenage, on the adolescent sexual and reproductive health that we designed with the with our NGO, to ensure the teenage access the information on their mobile app. And also, in case of the area for partnership that this dialogue was designed for, I think this is 2 areas that stakeholders are welcome to work with UNAPA and the Ministry of Health. One is to scale up, the number of health facilities to provide a high quality sexual reproductive health, including the youth, adolescent, EMOC, the family planning or violence against women. And also, secondly, the training for both pre-service and in-service midwifery training, because so far, we have a curriculum for the pre-service, for 3 midwifery curriculum, and in-service for our EMOC. And this is give you a closer looks in terms of short-term partnership, how you can work together into the next year, to roll out the e-learning platform. Maybe welcome to join to add more topics, and then to support the infrastructure, the training, also the telemedicine. All those we have started, but we need more support, in terms of recording, and also the training, refresher training, to ensure our provider are confident. And also pre-service midwifery training, that is talking about the support to design the course syllabus, to deliver, to implement the new midwifery curriculum at our public and private training institution, because every at least around 300 midwives graduates, are deployed into the health facility. So this is the right chance to invest in the pre-service education. And also you can support us through the in-service training equipments, for EMOC, family planning, gender-based violence, because we need more support in terms of equipment, delivery kits, delivery bags, to distribute to our facility with low resources. And also in terms of CDHS, in-depth analysis, we can analyze, critically in terms of the causes of the MMR, the family planning, the PNC, and in addition to this, the long term, we can, in addition, what I mentioned is you can continue to work on the rolling out of the app and the chatbot for GBV and WOW. So that's all from me. Back to you. Thank you.
So, thank you once again, Mr. Nguyen, for your valuable remarks. So we can see the concrete evidence and data on the areas that have been improved, as well as the challenges that we will need to overcome to acquire the intended goals. So we can see that this requires collective effort. People need to be educated about the issues pertaining to their health, but providers also need to be equipped with the necessary skills as well. So innovations like telemedicine and e-learning are extremely crucial to tackling this whirlwind of challenges. And it is important that we adapt to the challenges thrown our way, like the COVID-19 pandemic. So your presentation will be extremely valuable and useful to our discussion later on. So Excellencies, distinguished guests, ladies and gentlemen, we've enjoyed speaking and talking with our honorable speakers today. So our program is now approaching to the open discussion session. So if you have any questions or any comments that you would like to extend to our honorable speakers, then please feel free to leave that in the Zoom chat box or the Facebook Live. But in the meantime, we already have a line of questions waiting for us from our audiences in both Zoom and Facebook. I will be reading out the questions and also posting the questions in the chat box for easier facilitation. So our first question from our audience is, what are the biggest challenges that RAC or UNFPA has met in providing services to the people in implementing your programs? And has there been any support from the government to both organizations? So as you've mentioned, there is a line of challenges coming your way, but I think what our audience is trying to know is that what is the most fundamental problem that we need to overcome in order to achieve our goals. So if you are ready to respond to the question, then please feel free to unmute yourself. Thank you.
Thank you for the question and the summary. Allow me to answer the question first. Yeah, the question is really critical, and in terms of the most challenges for to provide services to the community, I would say the unreached people population, unreached population, including the ethnic minorities, the migrants workers, so also the women, experience violence. I think this is the area that we have to pay attention. In addition to that, Ministry of Health have done a great job, as I highlight in the CDHS finding, in terms of ANC delivery very high, but we have to work, we have to pay attention to these vulnerable groups. And in terms of the support that we have received from the government, I think the ownership, the ownership and support, leadership, from the government, for example, as the result of UNFPA support in terms of contraceptive procurements, the government have invested, a huge amount of budgets in procuring commodities, to distribute to all health facilities. So I think that is the positive contribution from the government. Over to you. Thank you.
Yes, thank you very much for the question. It's very interesting question actually, and it's very critical to think about what is the most challenge. Actually, as I mentioned, for that we have done a lot of work, and also in different parts of services. For example, it's not included the services providing us health services, but we also serve for the community related to raising awareness and see, and also promoting how the community can exercise. Yeah. So there's a lot of challenge, but actually I can one comments that it related to building the resource for sustainability. Why I raise up this point, because if we want to do something and we need all support, not only one, but all, everyone, every partner, and also the main agency as our government to do that, and to make it sure that all of the services are provided, which they maintain it, even those they are missing out someone. So really the resource for sustainability is very challenge. Example of this point, I can raise up CSE implementation. Even though we have a very close collaboration with the Ministry of Education and Sport, and we can see very positive progress. But we need time, and we need a lot of resources to ensure that the CSE could be rolled out across the nationwide. We need time, we need support, we need technical support to ensure that all our teachers can provide the actual knowledge to the student, and to ensure the age appropriate, as well as how they can have a space to exercise their knowledge without any judgment. So it is, I think it is one of the most challenging that I can say. Thank you.
So thank you to both speakers for your wonderful responses. I hope our audience has noted down a lot of key takeaway points from their responses. I will now continue to the next question. I will also be posting this question in the chat box for easier process facilitation. So teenage pregnancy can be tremendously reduced if there is more awareness among adolescents on the type of contraceptive methods. So similar to what you have responded before, so how can sexual education be promoted and encouraged in our education system? And I will also be including another question that is along the same lines. How can sexual education be promoted and encouraged in our Cambodia's educational system, especially when we take into account historical practices or the cultural setting in Cambodia surrounding the reproductive health and rights? So this question is extended to both our speakers, so please feel free to unmute once you are ready to answer.
Thank you for the second question. Let me put this in the, in terms of the comprehensive sexuality education. I think under the Ministry of Education and Youth and Sports, the CSE, the Comprehensive Sexuality Education Integrated, if I'm not wrong, maybe started from grade 5, until grade 12. This is a very gradual from lower to high level to ensure the adolescent and youth, are informed, and how we can ensure, the young people can access the information. We have to look at both in school and out of school. I think in school that would be okay because they are equipped to with the knowledge, but out of school that is a concern. We have to work, have to fix alternative solution, how we can provide information to the, to them, to access, to get them informed, now the consequences, the choice for them. So I think this is the area that we have to think together, and also in terms the role of the social media, we have to, I say, innovation and digitalization play a vital role, to spread the information on services where they can seek health care on sexual and reproductive health. Also, the example I raised about the app on the teenager, they can access the information. They have questions, they can click by themselves. They can access to the information close to their settings. So yeah, and in addition, the culture, I think also parents play another important role, to support, because from the adolescent assessment carried out recently, the most of the sources of the information also come from their parents, in addition to the school. Yeah. So over to you.
Yes, thank you again for the question. In order to reduce high risk factors related to sexual, the sexual related to sexual practice among youth, that is why we can see a lot of commitment of our government to put the subjects, the new subjects of health education. And as we can see that the national curriculum has been endorsed since 2018. And after endorsement, as UNFPA, who is very actively involved with the process of, even those started from the life skill learning, like, excuse me, we have been done a lot related to the CSCs in I think since 2013, we have life skill learning subjects, which is sorry, I have a problem with my source phone. So at the time, the life skill and CSE, it's not a mandatory subject. But after we see the very significant knowledge related to reproductive health and sexual health and rights for among our youth, that is why our government endorsed the subject and put it as one of the components in the health subject, and we have it now as a compulsory subject. And started from 2018, the Ministry of Education worked very closely again with UNFPA, and that we developed a textbook. And as our colleague mentioned a moment ago, that the CSE component have from grade 5 to grade 12, which is very important for them, and we develop it with a very age appropriate, which is also respond to our cultural aspects that maybe somehow it's kind of sensitive, but we are sure that the CSE is implementing based on age appropriate, and each of the topics is linked together to educated youth to understand about not only the high risk behavior, but also how to respect and how to promote their well-being. I can give you an example related to this subject. The lesson over there, we can have like they need to understand about the state of their puberty, about sexual violence, about safe relationship, their communication, and sexual harassment. It's all about the subjects that can build up the capacity and understanding of youth to understand how to protect and also practice their rights in a very positive way for their livelihood. It is the point that we can see, and we are trying to ensure about the technical with not only the national experts, not only with our core team from the school health department of the Ministry of Education, but we also consult with the international experts and we contextualize that to ensure that all of the points could be understandable and accepted in our cultural context. Thank you.
So thank you to both your responses. So we can see that the government has done a tremendous job in implementing and including reproductive health and rights and sexual education into our educational system. I think our next question is related to that in a way. So it's also something that you have somewhat mentioned previously. So how can we improve the coverage of information to people in rural areas who often lack education? Because we know that sexual education is incorporated into educational systems. So those who are able to be educated are informed about that. But people in rural areas or people who live in a distance may face problems regarding that. And also minorities who are often overlooked, who are often underrepresented in policy making processes regarding to campaigns and all of that. So in what way can we improve the coverage of information on reproductive health and rights? Thank you.
Thank you. Maybe Sumoli, you want to go ahead with that question?
Yes, thank you. Actually, I'm sure that and UNFPA are trying to work hard to not only capture the in-school student, but also out-school student. And as our colleague mentioned, Mr. Ross mentioned about the digital platform, it is very important to cover not only the in-school, but really focusing on general, that everyone can access to the information and not only one platform, but we are trying to work like video online platform and any, as I mentioned, like these, and we go directly to the rural area and also focus it on the vulnerable group. For example, like we work with the government factory workers. We also focus on entertainment worker, and people with HIV, and also people live with disability. So this is all we are trying to capture everyone and don't want anyone left behind. But not only the platform, but I'm sure that we are working together to plan producing the curriculum, the national curriculum for our school. We focus on as it is the way that we are trying to work. This our school curriculum will be in the discussion to capture all of the target group. As I mentioned a moment ago, youth living in the prison and factory workers and the other general. So as I mentioned, the challenge is time and resource. We committed to do it and we are working to plans, but we need time to show that what is the result after that, and we ensure that we are trying to make sure that everyone can receive the knowledge and information related to the sexual reproductive health and rights as they could possibly receive it from us. Thank you. Maybe anything Mr. Austin, please.
Thank you. I couldn't agree more with Sumoli. Just allow me to add a little bit in how to convey information to those who are underserved groups, especially with low education. It is clearly stated, according to the CDHS, the lower education level, the higher teenage pregnancy. That is clear. So information is critical to ensure they are informed, make the informed decision making about their sexual and reproductive health and rights. So I think we have to as I highlight in my PowerPoint, we have to put our radar on the community engagement. We have to work closer to the communities. This can be done, to engage from with local authority, how they can support, support the community, the teenage adolescent. We have to work with the health center, the village support health group, the school that UNEP have supported, through the Ministry of Health and Education to have the regular meetings between the school, between the community and the healthcare providers, So also in addition to the app and chatbot that I mentioned, that we can roll out, and because if you look at our community, I think most everyone have a mobile phone, so they can access the information. And also we have to work with the private sector because they are the one who are, at the community, and they also the one that can attract the, clients, especially the young people, to get services. So in summary, I think we have to work in the community, to hear their voice, how we, how to bring closer relationship between the healthcare provider and the users. Thank you.
Thank you once again to both your responses. I hope our audience today have gained a lot of insight and knowledge into what can be done and what projects that we can implement on this issue. I will now be moving on to the next question, which is actually a question from our Zoom participant. So as there are many concerns about the price and quality of healthcare systems in Cambodia, and many people choose to go abroad or to other countries, which shows a negative point in healthcare system in Cambodia. So from your perspective, what can be done to solve this problem? How do we build trust, people trust, to consult with professionals and actually receive treatments in the country when they face these problems without having to go abroad? Thank you.
So Somali, you want to start, or yeah?
Yes, thank you for the question. Actually, I am working as a program implementer, so I really don't have any exact comment on how we could work on it to improve it, because if I speak out, it's the same as I am also one of the simple the general ones. But somehow, as we can see, Mr. Pros mentioned about a lot of data that can show the improvement of the services as well as the result of services providing in Cambodia has been a lot of improvement, even though there are a lot of challenges that needs to solve more. But as I mentioned, we need to take time, and we also need to advocate for everyone to work together as a partner and to accept and then take the action of how can we do to address the gaps and any challenge that raises, not only between the technical teams, but also from our general population in Cambodia. Thank you.
Thank you, Somali. Let me just add a little bit to your points, your great points. I think, yeah, it's a rumor that the number of users going abroad to seek healthcare, and also there is the trends that the local access the public or private health services in the countries. So I think how to answer the question, how to address that negative effects of this information in terms of quality and trust. I think we have to start with the information. We have to spread our information, to the audience, because I think the current gap is the information. Because when the people is sick, they don't know where to go. So I think we have to work around the information, where they can get the information, and also secondly the quality. Now we have to work about the quality. What it meant is the standard. We're talking about standard. The standard, the client satisfaction, the safety, the efficiency. So now the Ministry of Health have introduced the accreditation system, to ensure the health facility, and provide the safe and quality healthcare. I think they have worked a lot, and also we see the number of users have sought care from the health facility. I think that we have to keep moving forward with our current progress, and we have to improve the ethical behaviors of our healthcare providers. That the government, the Ministry of Health, have working a lot in terms of the, we have the, for example, in the midwifery areas, we have the standards of midwifery practice, we have the scope of midwifery practice, we have the competency for midwifery education training. So that is standard in line with the regional and global standards. And yes, so of course we have to, they have to improve our client, especially the client satisfactions, the infrastructure, the cleanness of the health facility, and also with the adolescent user-friendly services. I think that is a critical area that the public health facility have to accelerate, to regain the trust from the public. Thank you.
So thank you once again to the responses from both our speakers. So as Dr. Somoli has mentioned, it's required that we work together to actually see a difference, actually see a change in the challenges that we want to overcome. And as Mr. Nguyen has mentioned, also that people need to have access to accurate information to build trust, to know where they can seek help, where they can seek professional services when they need help. And also providers will also need to be equipped with the necessary skills in order to see a difference in this challenge. So I will only take one last question, seeing how we have answered a lot, and I'm sure our speakers have other schedules to commit to. So I will also be posting the question in the chat box. So the question says, some girls and women may be reluctant to open up about sexual concerns related to unwanted pregnancy and reproductivity, and would search for information and practices on the internet, which is mostly dangerous, especially with the increasing circulation of false information on social media and on the internet. So what can be done to solve this problem? So can there be fact-checking mechanisms or other solutions to this? And I think it also pertains to the previous point that you have mentioned now with the digital transformation. We have implemented innovative programs regarding e-learning and digital education. So the social media platforms and also the internet can be a platform for people to seek information, good information, but also there's sort of like a mix of bad information out there as well. So what can we do to actually solve the issues and problems of false information on the internet, especially when it comes to reproductive health for everyone, every user? Thank you.
Thank you for the question once again. I think we have the same concern. That is why everyone, the government, media, the group who working for promoting sexual and reproductive health and rights, including the CAC. It is one of the solutions that we are trying to make it for our generations and for the next generation to access to the trusted knowledge and information through the CSE curriculum, the subjects of health education. So I am sure that when we are working on this, CSE for the national system, for the national to roll out nationally, we provide the sure and accurate information for youth, and we also link youth to access to any information and any platform that is possible to provide right knowledge and information for them. For example, like MBA trying to working hard to reduce the CSE material, including books, hard copy, and also digital platforms. So, as he also mentioned that lack of information for youth is very, very challenging, and they might need to guide properly to understand where they can access the information. And we are trying to work now to ensure that we broaden the sources, the resources of knowledge related to sexual and reproductive health and rights that could possibly share not only to the digital platform, but we try to access directly to the community to ensure that they can receive the accurate information. Thank you.
Thank you, Somali, for the response. Let me add a little bit. I think in terms of the reliable information, basically the clients or women, I think firstly, they have to ask themselves first, when they have a question about the sexual education, the preconception, pre-pregnancy, preconception, family planning, where should they go? So my response is to there are various sources. One is the public health facility. It can be health centers, hospital or provincial hospital and national hospital. So for example, UNDP have trained, supported the provincial health departments to train our guideline on the adolescent youth sexual reproductive health services on gender-based violence. So there are a number of health facility, health center that can provide those information very, very professional. So basically just start with, the skill, healthcare providers, through the public health facility. And secondly, if, through the like private or NGO, I'm sure for RAC, they have very number of clinics in the country. They very specialized information agency in the SOA services in information that we have to, they have to do, I think they have to do their research, in terms of the NGO who can provide, but they have to ask themselves, what are they, the professional trained, because currently what I can reassure that all health professionals are required to register and license to practice, So I think that also maybe you can just, for example, like midwives, they have to register and license to practice, so they are recognized as a professional, so they can provide reliable and accurate information. Yeah, so I think this is my response that we can address, this concern. In addition to what I mentioned about the app, we have app for teenage sexual and reproductive health. They can access all information. So far, we just started at early stage to design the app. So we put it on trial, and it's run by the, in partnership with the Ministry of Education and the NGO. So, and then we will scale up, ensure a range of mechanism and tools, access to the available for the communities. Yeah. Thank you.
So thank you so much to both your responses. This has been an extremely fruitful discussion session. So thank you once again, Excellencies and distinguished speakers, for your valuable comments and your interesting presentations on the projects and the innovations that have been implemented so far. So due to time constraint, I would like to end our discussion here. But before closing our program, I would like to invite all honorable speakers for a group photo session, please. So I will be counting to 3, so please don't forget to give a warm smile. All right. If our technical team is ready to take the screenshot, okay. All right. So 1, 2, 3. Can we have another one? Okay. 1, 2, 3. Thank you so much to all our honorable speakers for your kind cooperation. So to end our program here today, please allow me to express my gratitude to our speakers for spending your valuable times today with us, and to all our audiences for following our program until the end. We would like to wish our distinguished guests to be safe from the COVID-19 pandemic that is still ongoing, and we would like to apologize for any unintentional mistakes that have taken place during our event. We wish you all the best. We hope you have a pleasant afternoon ahead. Thank you and goodbye.